All right, my next question that I've got here is chemical stress. And how does chemical stress show up as physical pain? So this is a really great question. Thank you for asking this. So some people ask me like because when I work with the body, when I teach my spinal flow students how to feel and how to palpate the spine, I'm asking them to feel the difference between physical stress, chemical stress, and emotional stress. So they are learning how to have a feel of the body and determine what type of stress has been stored. Is it physical? Is it chemical? And is it emotional? And most of us have a combination of all three. We do have layers and layers and layers. If you've got some type of pain or some type of something and it goes away within a few days, then you know what? It hasn't stored in your body. But when you've got something that's a little bit more chronic, that's there and it's not going away, then you can assume that your body's stored a few layers in there. And those layers will be comprised of physical stress, chemical stress, and emotional stress. So when I say chemical stress, I'm talking about the foods or the toxins that we're putting in that can result as a spinal blockage. When I say foods, it can be, anything like, alcohol or cigarettes or, toxic foods or environmental stuff as far as, what's an example, like, pollutants and pesticides and all the things that are not food and not easily digestible that are coming into our system. And now if we just have normal foods that are, that have grown from nature, from really good soil, we're able to process them and they come in and they get eliminated out. And that's the cycle of food. What's happening now is that the foods that are coming in or the environments or the pollutants or the toxins that are coming in, we're often not able to digest them. Not only is it what's coming in, it's also the amount of stress that we already have in our bodies. If we already have bodies that have got spinal blockages in there from emotional stress or physical stress, when we bring the food in, possibly we're not able to digest that because the organs that are in charge of, digesting and assimilating and eliminating aren't working how they need to be working. And that can make sense because you speak to so many people and they say, hey, I'm allergic to tomatoes or oranges or capsicums or bananas or strawberries. And you just start to think, well, hang on, is it the orange or is it the strawberry? Or is it that something's happening with their body? And they've already got stress in their body, so their body's not able to do what it needs to do with the fruit or vegetable. I understand when we're putting crap in, it's okay that our body says no, but when we're putting foods in that are from nature, which again, that's another whole topic because right now we can probably say that there's not many things straight from nature at the moment, but our bodies are designed to break foods down. Now, if there's chemical toxins out there and we don't know how to digest it, what happens is the body recognizes it as stress. It recognizes it as, I don't know what to do with this. I can't process it. It's not going to come through. So it's going to store in my body. Where it stores is in the spine. It's stored, how it's same with emotions. I always talk about you have emotional stress. When you can't process or deal with an emotion, we say, hey, let's put that to the back of our minds. The back of the mind is a spine. It's the same of when chemical stress comes in and the body says, I can't process or digest this. It gets stored and it gets stored in the spine in the form of chemical stress. And what chemical stress feels like as a blockage, we can do this together. If you put your finger up and you press, if you make the knuckle hard and you press the knuckle there, so rather than moving like that, if you can see my finger, that's good movement. When you press quite hard through there and you make that knuckle hard, that's what physical stress feels like. So when I'm teaching my practitioners to feel the different types of stress in the body, I teach physical stress like that. It's going to feel hard. But how chemical stress feels like is it's got hardness there, but it's like there's a marshmallow on top. softness or sponginess, and that shows us that chemical stress is being stored as a spinal blockage. And when chemical stress is stored as a spinal blockage, you can have pain or disease or illness. It will interfere with the nerve supply that needs to come out of that vertebra to where it needs to go. So chemical stress is one of the major causes of spinal blockages in the body. And so when we're talking about, but hang on, if the chemical stress is stored and it's finding a place in the spine, why does that mean pain? The reason it means pain is because it's interfering with the nerve supply. And if it's interfering with the nerve supply, it's interfering with the function that the spine and the nervous system needs to travel through the body. If it's interfering with the message, the body's shooting out pain, sensation, and saying, hey, I'm not okay. I've got spinal blockages here. I need help. And that pain may be an imbalance. If the chemical stress is causing the vertebra to not move, if it's causing hypomobility, which means rather than moving like that, there's stuckness, it might mean that one area may not be able to weight bear, so another area has to weight bear instead. Different muscles start to contract, inflammation can go on, and they're all signals that the body says, hey, something's going on, and pain will come from the nervous system to say, hey, stop, this is not working right now. Pain is a message from the body to say, hey, something's not okay. We need to have a look at it. So chemical stress is one of the 3 stresses that we have in the body. So we've got chemical stress, emotional stress, and physical stress. They create spinal blockages, and when we have a spinal blockage, that can cause pain in the body as well. So hopefully that helps you with really looking at why chemical stress can cause physical pain in the body. What we need to do is we need to have a look at where that stress is coming from, looking at how we can reduce, how we can eliminate the stress coming in, but also having a look at the stress that we've stored in our body to really start to move the layers as well.